Hi, this is Kunal Shah, CEO and co-founder of ClaraSim. We are enabling medical professionals to interact with their patient imaging in much more interactive and clinically meaningful ways than they can before. The example we're going to walk through right now is of a dentist looking at one of their patients. And so what you see on the screen is a real patient cone beam CT. So this is a virtual model derived from a real patient scan that one of our dental partners sent to me. You can see the pretty high resolution here from a cone beam that was taken clinically in the office. It's not a cadaver scanner or anything like that. This is just a regular patient scan. You can see it rendered fully in 3D with all the bony structures kind of identified per the CT. But what we're actually going to do is we're going to allow the user, in this case myself, to actually start operating on this virtual patient and experience what it would be like um, to not just spatially uh, go through this procedure and kind of what happens where in the anatomy, but how the anatomy changes over time. And it's going to give our dentist or our oral surgeon a much deeper view into this patient's medical condition than they would otherwise. And so I'm gonna keep in mind I'm not a dentist nor an oral surgeon, so I don't actually know what I'm doing medically. But what I can do is I can use this 3D mouse that's on my desk here, and the handle that's in my hand, and I can actually bring it closer and closer to the model until it touches. And when my virtual drill touches the virtual patient, what's interesting is that I actually feel a physical response. I am feeling the force. I physically cannot push this drill any further into the bone. I'm feeling the resistance and the textures that happen as I move my drill over these anatomical regions, as I move my drill over these teeth here, right? And again, I'm feeling a force feedback that correlates with what this patient's actual bone density is here, and how that would feel if a tool like a dental drill was applied to it. And so this is a very realistic sensation with the 3D rendering and the haptic feedback that's correlated to a patient's bone density. Um, but there's more. Remember I said we can actually interact with this model, not just by looking at it, spinning it around, and seeing whatever, but I can actually start drilling into it and experience what that would feel like as I make these changes. So again, I'm going to pick this tooth somewhat at random. Again, not really sure. I think this is not really sure what the disease states are because I'm not a dentist. But if I had to drill into this bone, I could start actuating the drill. I'll narrate over the sound here. But if you look closely, you'll actually be able to see the topography of this bone, of this tooth, changing. And you'll start to see some of that tooth being drilled away, shaved away over time. And remember, this is rendered in 3D, so let's say I drill a little bit and I want to see what it looks like from all these different angles. I can do just that, right? I can see what it looks like from the front. Okay, I have that much curvature. Go back here, see what else is going on, turn it around from the back, and yeah, and then I can look at it and keep going. And remember, I'm feeling the resistance that you would feel if you were shaving away with a dental drill into a bone of this particular density. I'm hearing the sounds associated with that, and I'm seeing the model update in real time. Let's say I were to take out this bone completely, this tooth, for whatever reason. I'm seeing what the model would look like and what the patient's anatomy would look like as that changes. See, I know I've gone too far, and I know I'm now exposing some of the patient's blood vessels and some of those air cells that we probably don't want to drill into, right? Um, and so this is just an example of how this can be used. Remember, we're trying to enable medical professionals to interact with their patients' imaging in much more clinically effective ways, clinically meaningful ways that allow them to deliver their best possible care to their patients. And so by showing them what a surgery would look like, not just in 3D, but over time in 4D, and with a touch sensation in 5D, essentially, um, we can give them a much deeper understanding of their patient's anatomy and the surgery and the procedure they're about to perform than they could previously.